Hello, everyone. Today we'll be discussing an abortion safe house proposal, which would make women's reproductive rights easier to access for the women living in states that do not allow abortions anymore. For a background, Roe v. Wade was overturned in 2022, which resulted in 13 different states making the decision to ban abortions or create gestational age limits. By law, when Roe v. Wade is overturned, states have the power to decide whether or not they want to restrict reproductive rights and regulations such as gestational age limits. There have been a lot of issues regarding this surrounding women dying in Texas and other states that have banned abortions because they couldn't receive the care that they needed due to miscarrying. They couldn't receive an abortion or a procedure to remove the fetus, which resulted in an infection within them, sometimes resulting in death. The rates of sepsis have risen from 2.9 to 4.9 just within Texas from 2017 to 2023, which is within the period of Roe v. Wade being overturned. Women need access for abortions just for other reasons than wanting a child. They need it for the complications that could occur that would make an abortion necessary for the health of a mother. If a fetus is not taken out of the womb after a miscarriage properly, like I said, it can cause to infections or sepsis, and pregnancies caused by rape or incest beyond medical reasons. Those, if carried to full term, give the mother a higher chance of postpartum mortality due to postpartum depression. Either way, women just need access to abortions for their own health, mental or physical, and I believe it should still be a part of women's healthcare as it has been for over 5 decades. I made this proposal for the audience of women living in states that do not have access to abortions, or states that are looking to give women access to something similar that I am creating the proposal about. Maybe medical workers or gynecologists, because that's a part of the team that I would implicate into the clinic or institution that I am proposing. Counselors as well, because abortion and just everything along those lines can be really hard mentally. And I will need approval from New Mexico government officials to allow patients to use Medicaid from out of state and to access a building and get it up running and allow people from out of state to receive abortions and proper care. There has been maybe 1 or 2 cases of states that don't allow abortions trying to get other states in trouble for allowing people and residents of that state to travel to receive an abortion, but legally that is not allowed, and women do have the rights to travel out of state to receive an abortion if they live in a state that does not give them access to one. Some cases related to the topic that I'm creating the proposal for is there has been 3 women in Texas that have died from complications after a miscarriage due to the abortion bans. One of them is Portia. She had 2 sons aged 5 and 3 waiting at home while in an emergency department in Houston Methodist. She was waiting for large blood clots because she was having a miscarriage, which she was aware of. She needed tissue to be removed from the uterus in order to stop the bleeding. It was a procedure called D&C. The doctors were hesitant to give it to her because they didn't know if she could get it without them getting in legal trouble or not, even though she was within the circumstances to need it medically and emergent. She was given misoprostol, but due to her being 11 weeks along, it wouldn't stop the bleeding fast enough, and the doctors knew that, so that was negligent on their part. All along in her case, the doctors were hesitant to give her any kind of medical care because they were too scared if they were going to lose their jobs or not because of the abortion bans and laws within Texas now. Josely Barnica, she was 40. She was in a waiting room and miscarrying actively while in the waiting room. Labor was not induced until there was no heartbeat within the baby. and the mother survived, but the baby did not. On October 29th, Nevaeh Crane, which was a very large case within media, she had died waiting to be seen from 3 different emergency rooms. The first emergency room told her that she had strep throat and completely ignored her abdominal pains. The second emergency room sent her home. They acknowledged that she was having a miscarriage, but they said the baby still had a heartbeat and she wasn't in danger of getting sepsis at this point, so they felt it was safe to send her home. She was at the third emergency room when she was pronounced dead because she did not receive proper care and her abdominal pain was ignored by almost every doctor. So by the time she was moved to intensive care, her organs had already failed and she passed away. If patients are to miscarry in the second trimester, especially if their water breaks or their cervix opens, they would need a medical procedure called emptying the uterus, and that needs to be performed to prevent sepsis and any other possible infections that could happen. There have been mixed reports from the doctors in Texas, some saying that in emergency situations that they are required to empty the uterus, but others are saying that they're not allowed to until the fetal heartbeat stops, or if there's a life-threatening emergency. In every instance within these mothers, it has been a life-threatening emergency, and they're still not receiving the care that they need. So that's just negligent within the doctors and within the state of Texas if the doctors don't feel comfortable to save these women because they feel they're going to get in trouble. The solution I have created is to create an abortion safe house within New Mexico, because New Mexico is one of the 30 states that still allows abortions with no gestational age restrictions. A lot of other states do still allow abortions, but there's gestational age restrictions, so New Mexico is one of the only states that has no limits whatsoever. A solution for other women who live in states that do not allow abortions would be to come to New Mexico to an abortion safe house, is what I would call it, or like a clinic. They could receive the medical help they need. It would be a larger institution located in downtown Albuquerque. There's a lot of medical institutions that I could partner with. There is a lot of buildings that are for rent or for sale that are large enough to where I could do something like this. The doors would need to be at least 32 inches for gurney entry in case there was a medical emergency within one of the women. It would offer a Medicaid-covered stay for up to a week after the abortion. If there's complications, they could stay longer. There will be childcare for any single mothers or just mothers in general who need to have care for their children while they're getting the abortion or any other instances. There will be like a cafeteria for food that will also be covered. I'll need to hire a primary physician, an obstetrician, gynecologist, nurses, and administrative staff like counselors, front desk workers, and scheduling and phone call workers. To complete the reproductive care center staff for childcare will be implicated as well as business partners who have experience in healthcare and operating and maintaining buildings. There will also be a staff of 4 to 5 individuals for cooking and cafeteria servers. If patients need travel expensive covered, state and local funding would cover the cost to support shelter operations, as $5.4 million was awarded to the state out of New Mexico for rural health care, including maternal care and services along those needs and lines. Travel would not be an automatic covered cost. I know travel is expensive, but if it was absolutely needed and the women had no other way, we could pull money and offer the help that they need. Emergency operation plans will be put in place for the electricity and water in case of any outages within the building or the state, which is very important considering there will be medical emergencies maybe, or just maybe the surgical team will be working and will need electricity, so emergency operations will be put in plans. States can have different regulations for how out-of-state Medicaid coverage is used. Patients can either get pre-approved for care for non-emergency out-of-state needs only if their circumstances are non-life-threatening, If a patient has life-threatening conditions and is already in the state of New Mexico, that would be considered an emergency medical condition under Medicaid's coverage. Medication abortions would be the preferred method of administration unless a procedure is necessary for the woman's health, not only for the cost but for a less invasive option as well. If patients is on a certain kind of insurance through Medicaid that cannot cover the cost of an abortion or allow out-of-state coverage, then the patient may have to pay for an out-of-pocket abortion for the medication or procedure. But if they came to us, we could figure out something financially to help them, maybe like a month-by-month payment or something along those lines. For the cost of getting the building and making repairs, I will talk to New Mexico Small Business Assistance Program to receive a grant for my business, and I will also collaborate with UNM to see if any funding is available for abortion clinics and care. Important people I would need to gain permission with for this proposal would be Tim Keller, who is the mayor of Albuquerque. He's a part of the Democratic Party, so that would be better on my end because typically the Democratic Party votes on sides of abortions. Kathleen Becker, who's the CEO of the University of New Mexico Hospital. That would be very important because I would need a lot of help from the University of New Mexico, whether that be getting nurses to maybe help or seeing if they have any funding for a clinic. Stephanie McClever, who's the executive director of the United States Health and Counseling Department, which is also called SHAC. I could ask her for help or just maybe anyone who would like to come over to the clinic and work as a counselor. Childcare workers and cafeteria workers who are looking for employment. That could also, I would need to gain permission with them to come work through the clinic to help me out. The cost of an abortion without Medicaid on average is anywhere from $560 to $725 in New Mexico. If there are any further complications resulting in surgical needs, that could cost anywhere from $2,000 and up. The budget for the entire proposal, I want a building that will consist of maybe 15 rooms for patients to stay, 3 different rooms for different age groups of childcare, a cafeteria and kitchen area, 5 surgical rooms, about 5 rooms for counseling offices, and a room for the pharmacy, and 3 public bathrooms around the building. With all the necessities, it'll take around $500,000 to make full repairments to the building and cover utilities, including electricity and water. Costs of relying on the state for Medicaid coverage depends on administrative tax due to the size of the buildings and the business. Costs of medical equipment is anywhere from around $150 per patient, including the medication, ultrasound, and any other necessities for the patient. Employees will have an expected pay of $38 an hour, as that is the hourly wage in New Mexico for nurses and medical workers. Childcare workers will have an expected pay of maybe $16 an hour, which is the average for childcare workers right now in New Mexico. All in all, the future that I envision from this proposal is just one where women's healthcare is seen as a necessity and not a choice that can just be taken away from us. A future where women can have free access to reproductive care in any state around the world, as this kind of care is just as important as any other healthcare for women. The goal of this proposal is to create an environment where we do not feel scared to speak up for what we need and when we need it, where women don't have to feel like they have to wait until the very last second to get the care that they need, to the point where they're on the verge of death. I feel as a woman that if we need medical care, and that includes an abortion, that it shouldn't be an obligation for the doctors to feel like they're going to get in trouble for it, and that they can just give it to us and recognize that we need it. A lot of women don't just get abortions because they want to get one to be cruel. They half of the time need them for their mental health or for their physical health as well. Abortion care has been a part of our healthcare for over 5 decades, and it just makes no sense why it could be overturned just like that. So the goal of this proposal was really just to give other states an idea of maybe creating something similar, or just for women a place where women can just feel safe to get an abortion if they need one and have everything else taken care of for them. And I hope that this proposal makes other women feel safer to advocate for what they need and inspires other states in the way that I want it to.